and she's involved with community outreach and education in the Bay Area. Thank you very much for coming to talk to us today.
Okay. Hi, my name is Allison Pallandrani. Like Dr. Polewski said, I am a physical therapist, and I wanted to talk to you about how we can manage some of the long-term side effects that we see with chemoradiation therapy, specifically with anal cancer. So just a quick about me. I'm a physical therapist, like I said, at the Pelvic Health and Rehabilitation Center. We have 4 offices: San Francisco, Berkeley, Los Gatos, and Los Angeles. And there's 8 PTs that practice throughout those offices. And we all are pelvic floor specialists, so we only treat issues that are concerning the pelvic floor, specifically pelvic floor muscles. So some of the long-term symptoms that are associated with chemoradiation therapy, specifically in anal cancer, are going to be pain, hip, pelvic pain, surgical pain if there was a surgery performed, fatigue, which can be a long-term or a short-term side effect, lymphedema, general musculoskeletal concerns, which we'll get more into towards the end, and then pelvic floor dysfunction. So how can we help? How can physical therapists help you manage symptoms, side effects after anal cancer treatment? Well, I think there's a big role for rehabilitation to help manage these symptoms. There's virtually nothing in the literature. However, I think there's some good clinical evidence that we see just as practitioners. So pain. Pain can occur because we've gone through radiation. There's permanent damage to some of those tissues. And it can also occur because we change our movement patterns and some of our physical functions because of the cancer treatment. So things that we can do are, as physical therapists, we can do manual therapy to treat areas that may have myofascial trigger points. So that's going to be like a knot in the muscle, connective tissue dysfunction, any scars that may be there and adhered, and then working with the joints as well. We can also address, like I said, movement dysfunction that we may be seeing. We talk about posture, seating, what you should be seating on, cushions, gait, and then issues with the lumbar spine, the pelvis, or the hip. Fatigue is an issue. Like I said, it can be a short-term or a long-term side effect of chemoradiation therapy. There was a Cochrane review in 2009 that found that exercise was statistically more effective in relieving symptoms of cancer-related fatigue than the control. The control did not exercise. And then Stricker, there's a study by Stricker in 2004 that found that moderate levels of exercise or physical activity were shown to help relieve some of the effects of cancer-related fatigue. That study also mentioned that if individuals feel that they're becoming weak or deconditioned, they should be referred to rehab to maximize their functional status. Because as we just said, exercise is something that we should be doing lifelong. So PT can help with planning out your day, pacing the physical activity, because it's not something that we want to be pushing through. It's something that we want to be kind of working with and managing. Lymphedema is something that we can see post-chemoradiation therapy. So things that we can do to help and that you can do at home as well are manual lymphatic drainage, always looking at the skin integrity, compression and fitting for compression garments, exercise programs to help manage that lymphedema, and then maintenance programs to make it as best as we can and kind of maintain that level. So general musculoskeletal concerns that we see, muscle weakness. So radiation is going to damage the tissues that it touches, and it can cause, permanent muscle weakness. We can see neuropathies from the chemotherapy, and then we can see just kind of general deconditioning again. So we need to help create sort of optimal exercise programs to create better movement strategies and just better kind of quality of life for some of the changes that are associated with chemo and radiation. So pelvic floor dysfunction is the big one, and when we're talking about anal cancer, this is something we see a lot and what I treat a lot in my office. So we see commonly anal canal and vaginal canal stenosis. That's a narrowing of those canals. We can do manual therapy to help maintain the patency of those canals or the openness. We can also work with you to use dilators at home to kind of have a progressive program to maintain patency. Gas and fecal incontinence is something that's really common, and so we can work to strengthen the pelvic floor muscles as well as we can, work on endurance, motor control, motor planning. We can also, to help with some of that pelvic floor muscle function, we can use biofeedback or neuromuscular electrical stimulation. We can also help with management of those symptoms. Sexual dysfunction is another issue that we come across pretty frequently, so pain and erectile function. We had better luck managing the pain. There's one study that was out on actually post-prostate cancer and erectile function, and it found that strengthening the pelvic floor muscles helped with erectile function. So what you can expect if you were to come into pelvic PT, we would want a thorough medical history and explanation of your symptoms, what you're experiencing. We would want to do a structural and biomechanical evaluation of you, so we'll watch you walk, sit, stand, look at the joints, look at the pelvis. And then we would have you undressed from the waist down, and we would do an external exam, because basically the muscles and tissues from your ribs to your knees can be affected when we've gone through chemoradiation therapy for anal cancer. So we're going to want to evaluate all of those tissues, and then we're going to want to do an internal exam per vagina or anus, so or both. And so we're going to, in that way, evaluate the strength of the muscles there, the muscle tension, the motor control. We're going to want to palpate the nerves, and then the tissue integrity as well. With all PT, you can expect some kind of home program to be doing some things on your own to help with what's going on. So physical therapy would be appropriate after you've been cleared from your physician. Anytime post-surgical, post-radiation, if you're having pain, which people commonly are, and that's lower abdomen, groin, vaginal, anal, genital, or scar pain, common what we see. Any bowel bladder dysfunction, so incontinence, constipation, urgency, frequency, pain with bowel movements, and sexual dysfunction, pain or erectile function. So just implications into the musculoskeletal system after chemoradiation therapy, and this is what we're treating. It's going to be pelvic floor muscle hypertonus or tension. Sometimes that insult to the tissues can cause our muscles to guard and just hold tight. That can contribute to constipation, incontinence, can contribute to sexual dysfunction as well, and urgency and frequency. We can see pelvic floor muscle weakness sometimes, which can contribute to incontinence. Neural irritation, especially from chemotherapy, which can cause pain and erectile dysfunction. Abdominal muscle dysfunction. Scars, if they're present, can cause pain and hypersensitivity. And then the overall deconditioning is something that we really want to address as well. Oops. Okay, so the role of pelvic physical therapy in management of some of the long-term side effects that we see after treatment for anal cancer. Like I said, I think there's a big role, and I think there's a lot of help that can be had. So we can normalize some of the pelvic girdle and pelvic floor muscle tone, strength, and motor control. We can get rid of the trigger points, which are like knots, improve the fascial mobility, improve any structural biomechanical impairments that are present, help you develop and manage an exercise program, and then help to educate you on what's going on and what you can do yourself. So I just put on here a couple links of how you could find a pelvic physical therapist if that was something you're interested in. The International Pelvic Pain Society has a spot on their website that lists PTs by state. The American Physical Therapy Association, they have a thing called the section on women's health. I don't know why they named it that, but many of the therapists on that website treat men and women. And then I just put my website up there, pelvicpainrehab.com, because you're welcome to call and ask us if you have any questions. So again, my email address is up here. Feel free to email me if you ever have any questions, but I would be happy to answer them.